Hi everyone. So I'm going to be doing an assessment on Mr. Bear here because my other patient was not cooperative. I'm going to be doing the upper extremities, the abdominal and lower extremities portion. So I'm going to adjust the camera a little bit here so you can see. So first thing I'm going to do obviously is make sure that I provide adequate privacy for Mr. Bear here. Perform hand hygiene prior to beginning the assessment and make sure I explain thoroughly what I'm going to be doing to Mr. Bear so he's comfortable with me. Ask him if it's okay. Make sure to get permission. I'll begin my assessment first of the upper extremities with anterior and posterior inspection. I'll be noting any abnormal skin color, if I notice any swelling, edema, any kind of lesions. Just basically a quick overview of the skin of Mr. Bear, and then I see that there are no signs of lesions. Everything seems intact and normal. I will check the fingernails of Mr. Bear, make sure there's no cracking, that there's good circulation, that there's no signs of any kind of trauma, or maybe he's prone to biting his nails. You would notice things like that. As you can see that he does not have any nails, but I'm just going to say that everything appears normal. As I'm assessing his anterior and posterior, I'm also noting if he had his muscle bulk, which is basically the size of his muscles, just making sure that everything appears symmetric and normal, nothing obviously wrong, just from a visual inspection standpoint. Everything seems normal on Mr. Bear. From that point, I can move forward to palpation of the anterior and posterior portion of my patient. I will grab the hands and check circulation by cap refill, obviously. Make sure that's responding well and I'm getting good color. I also can check at this point the radial and brachial pulse, and I will do this bilaterally. 30 minutes for normal, 30 seconds for normal, 60 if it's abnormal on both sides. I will also be palpating his muscle bulk or her muscle bulk if it's a female. Making sure that there are no abnormalities with the muscle size or appearance, and everything on my patient seems normal after going over it thoroughly. Ask if there's any pain associated when I'm palpating the upper extremities. At this point, I can do a strength test. In the arms and hands, I'll have the patient hold out their hands, and I could hold out 2 fingers, have them squeeze my fingers. Make sure, yep, +5. Bilaterally on both sides, so he's got good grip strength. I would have him lift up his arms, or rather, you could do it from the side and have them just flex up while you're pressing down on the hand to check if they have good strength against resistance. +5 on him, he's normal. Bilaterally, of course, and from that point forward, you can check range of motion, which would include having them extend and flex their arms. You can notice if while they're doing this, while you're palpating, if you feel any kind of crepitus in the joints when they're flexing or extending their arms. You can have them raise their arms to the side or up above their head. Get a good see if they have good full range of motion. Again, assessing if you feel any crepitus or if you hear any cracking, crinkling in the joints. Ask if there's any pain. If you see any obvious signs of pain, make sure to follow up with them about that. Oh, you seem like there's a little bit of pain when you do that. How is there pain associated when you move your extremities at all? And assess as they answer. Full range of motion on both upper extremities, so I can move forward to the abdominal assessment. I'm going to have my patient lay down. I will grab my stethoscope. And when I am doing the assessment, I will make sure I am assessing for bowel sounds, starting with the right lower quadrant, moving up to the right upper quadrant, left upper to left lower, so making sure to check all 4 quadrants with the diaphragm of the stethoscope. So we'll start with the right lower. Again, before you do this, you want to, one, make sure that you use an alcohol wipe to sterilize the diaphragm of the stethoscope, and you also want to make sure it's warm, so it's nothing worse than being touched with a cold stethoscope. So start with the right lower, move to the right upper, left upper, left lower. All signs on Mr. Bear were normal. After auscultation of the 4 quadrants, I can note that there were normal bowel sounds, nothing irregular, not hyperactive or hypoactive. Make sure to document as you go. After auscultation, you would then palpate all 4 quadrants as well, lightly, of course. We're not doing deep, and just lightly pressing on the all 4 quadrants, starting with the right lower quadrant, moving up to the right upper, left upper, left lower. While you're palpating, you're making sure not to press too hard. You're making sure you're keeping an eye on your patient. If there's any sign that they're in pain while you do this, make sure to follow up with them about it. You want to be feeling for any kind of masses, any noting temperature, how the patient's responding when you apply a little bit of pressure through light palpitation, really trying to get an assessment if there's any kind of abnormal, anything feels abnormal in their 4 abdominal quadrants. Any kind of guarding, like I was noting. Everything seems and appears normal, feels normal. I don't feel any lumps, any masses. You want to note the umbilicus midline, which I've had dispute about this through researching it. It seems to be slightly superior to the actual navel. But, making sure to note that, and you want to notice if there's any kind of scarring on the abdomen. Like for me, I have had a appendectomy, so I have a few scars on my abdominal quadrant from laparoscopic surgery. There's nothing to note on my patient, so we can move forward with the lower extremities portion of the assessment. Again, you're going to be starting with you can sit the patient up at this point. You're going to do the same approach as you did with the upper extremities. You're going to be checking the skin for color, good color rather, any edema, swelling, any lesions. Make sure there's no skin breakdown of any kind, any moisture, skin tears, bruising, trauma on the anterior and posterior side of your patient. You're going to be checking the toenails, making sure that they're not cracked or chipped or missing. Again, good color, any signs of clubbing. Everything appears normal on my patient. So moving forward, you also want to be checking for the bulk, also the bulk of the muscle, the size of the muscle on the legs. Make sure they're symmetric. There's no abnormal size differentiation between the 2 lower extremities, posterior and anterior. Nothing to note. Moving forward, you're going to inspect and palpate at this point for edema. You're checking for the feeling any abnormal masses. You're checking the muscle bulk if there's any pain. You're staying in constant contact with your patient, making sure nothing is causing any kind of discomfort. You're going to make sure and inspect for range of motion at this point. You'll have the patient stand up. You'll note if they can bear weight. If they can't, you can have them sit in a chair. Since he's sitting, I'll just do it this way. I'll have him, and he can't flex his leg, but I would have him sit like he is right now, with his flexion in his knee. I'd have him extend one knee, do that with the other knee, do it bilaterally, make sure he has good range of motion, that he can extend and flex both of his legs without any kind of discomfort, any note of cracking or crinkling, any crepitus. You can be palpating at this point, making sure everything feels like nothing's catching. There's no abnormal swelling in the knee joint, no abnormal color or pain. You can also at this point test the strength of the patient's lower extremities by applying pressure to the lower portion of the extremity and asking them to push up against it during flexion. So extension, during extension of the knee, push against. Not, you don't want to apply too much pressure, but just enough just to gauge whether or not they can, how much force they can push against resistance. And my patient's really strong, so it's +5 on both sides, all normal. You want to check the feet, obviously, that there's no signs of abnormal lesions or color, edema, that they can move their toes, that they had good sensation in their toes. You can check the dorsalis pedis pulse at this point, make sure that you have good circulation, ask if there's any kind of pain, if they have any problem with the shoes that they wear, socks, if there's signs of moisture, any kind of skin breakdown, or you can check their heels, make sure if there's crackling from it being too dry, wearing the wrong kind of shoe, maybe they're tying their shoes too tight, and you can see actually like it seems like they're I know that when I've tied my shoe too tight, it could actually like you can tell that like something's been it's almost like the foot's been squeezed for so long, like you would notice that immediately though once you assess. So again, nothing abnormal to note of my patient, and overall a good assessment. Thank you.